Hello, everyone. Welcome. I'm Richard Laurion, and I'd like to share with you a little about my experience working as a VRI interpreter. I guess I can say that, or I often do tell people that I started working as a VRI interpreter a number of years ago. So it's probably been about 20 years now that I've worked in this capacity, and people think VRI is a fairly new phenomenon, but in fact it's not, because I really kind of reflect on my experience working as part of the state government in Minnesota as VRI work, although we didn't call it that at that time. As a staff interpreter, there would be often video conferences that were set up, and you may remember the systems back in the day. There were 2 television sets seated side by side, and then a camera. It was a Polycom camera. So with this Polycom system, we were able to watch through the television screen, and we could see individuals who were at remote centers. And we used this system anytime that we wanted to host a staff meeting. You know, our agency had deaf staff members who were located throughout the state of Minnesota, some in Duluth, some in Rochester, some in other places throughout the state. So we would be able to connect with them visibly through the Polycom system, and then deaf staff members could be a part of our staff meetings. So both hearing and deaf individuals could communicate through the St. Paul, Minnesota Center, where we were located, providing the VRI services. So that was the first work with video conferencing. Now, as an interpreter, we had a camera that was positioned towards us so that our work was then broadcasted to all the centers throughout Minnesota. And deaf staff members could watch on and follow the meeting as they were watching our interpretation. Now, should one of them at a remote center wish to make a comment, they would push a button and the camera would be directed to their center. They would then have the primary video feed, and they would be able to communicate their question. And then, of course, I, as the interpreter, would voice that into spoken English. And then once again, I would get the camera positioned back to me again as the primary video feed, back at the St. Paul Center. So we would do this kind of exchange throughout the entire meeting. And each center where they had a deaf staff member would be able to indicate that they wanted to make a comment and use the technology to direct the camera in their fashion. And then it would return back to the primary video feed. Typically, that was on the interpreters. So that's why I say VRI is not necessarily a new phenomenon, but something that's been around for many years now. You know, and the system that we used back then was ISDN lines, or run through ISDN lines. They were pretty cumbersome cables, and the phone system had to be tapped into, and we were able to broadcast a lot of data, which was good for video broadcasting. And that system that we used was a Polycom system. Well, now, of course, these days, technology is much better. We have broadband technologies, so we can use IP and, you know, go through the regular IP systems for our video conferencing or video relay interpreting. So with the technology being as it is these days, it's made VRI, well, I guess you'd say much better than it was back in the day, and much more available to individuals for daily use. And how I really get involved these days with VRI is, once again, in Minnesota. We have an urgent and emergency care system, and I can tell you a little bit more about that system here. So in the state of Minnesota, there are a couple of lawsuits that have transpired over the years, and through these lawsuits, deaf individuals were involved in medical situations, and the systems did not provide them with qualified interpreters as was necessary. And the courts decided that, in fact, they were ruled in the favor of the deaf person because they did not get quality interpreting services. And so with the hospitals being sued, now part of the settlement has been that the hospitals, of course, wanted to improve upon their interpreting provisions. And so they're doing so through providing first on-site interpreting as well as using VRI. So the way VRI is used today is that there is a system that provides services to all of the Twin City area hospitals. So we're talking here probably about 26 different hospitals in the Twin City Center, as well as urgent care centers. And in addition to that, there's also, you know, county jails And anytime a deaf person, that is, ends up in the hospital, they are able to access the VRI and an interpreter through the VRI for the purpose of triage communications. So as you're well aware, it's kind of the first place you stop in the emergency room is you stop at the triage desk and you do a basic intake. You explain to the nurse what the issue is, why you're there being seen today, what the symptoms are, and they take maybe your vital signs, your temperature, and check your blood pressure and check to see if there are any other physical symptoms that are evident. So through that process, we can very easily provide interpreting services for individuals in that triage area and able to provide them the questions through American Sign Language. Anything that the nurse is saying, we can communicate that to the deaf patient there. So the response for the VRI need has been in the state of Minnesota that we have had a network of interpreters who are willing to set up studios in their homes. So in these home studios, of course, we have to meet certain criteria or requirements. First, it has to be in a locked room where no one is able to access, just to ensure the privacy for individuals in the hospital and getting their medical care, or prisons if that's the case. So in addition to that, we also have to be able to provide high-speed connections. Another criteria is that we have to have a webcam so that, of course, we can assure good quality video picture that's being broadcasted. Another one of the criteria then also, and it depends upon which center you're working at, and this I have to mention is a problem area, is that many hospitals require that we use their particular software system. And each one of them, as you can imagine, uses something just a little bit different from the other. Some are proprietary and others are just basic, off-the-shelf kind of software systems that you can buy anywhere. Could be something like Skype or Uvu or even just a simple VP. We may be using then, as you see, a variety of different software systems in order to connect to the various sites. Even though, it seems to be a bit of a problem having so many different software systems, or it might seem to be a problem, once you get accustomed to using them, it's fairly simple. You know which one to use and very quickly make that video connection. So that speaks a little bit about the system. But in addition to the system, the interpreters also have to be available 24 hours a day, 365 days a year. And of course, that being the case, that means that the interpreters who are willing to work a VRI shift have to coordinate with others and make sure that they're home and available to accept a call at any given moment in time. So we have a schedule that's in place. We have interpreters who have volunteered to be a part of that system, and with that we can ensure 24-hour coverage. With this VRI system, we also work in conjunction with on-site interpreters who are providing services on location. And they are also on-call individuals. They wear a pager, and they are prepared to go to any hospital or jail if, in fact, a call comes in. It is a combination of services, you can see. It's not just VRI or just on-site services, but rather a combination of both that's used, which really works out very well. And some of the advantages to this system and why we like it, I guess I can say personally, I love doing emergency work, urgent care kind of work. And I always feel as though, I don't know, this is where I feel I'm most effective as an interpreter, that I'm actually able to bridge that gap in communication that can exist in that kind of a setting. And that's where I think is a clear example of why I became an interpreter. For me, I guess, using VRI is a perfect thing because it's great to respond to those emergency kinds of situations or urgent need situations when you physically cannot put an interpreter on site. It's just impossible to get someone there at a moment's notice. So with that, I see VRI as being a great solution really making use of the technology to provide services and solve a problem that allow people to connect. Now, of course, there are problems, but with that, I do see that as long as the system is well developed and in place ahead of time, you can predict the problems and resolve them before any issues really arise. What we found here in Minnesota is that VRI is also a really good option for interpreters who, need to work anywhere in the state of Minnesota. In Minnesota, we have some very big urban centers like the Twin City, for example, where there's 2.5 million people residing. But if you look around the rest of the state, there are a number of rural areas, and a lot of those are out in the wilderness, basically out in the middle of nowhere where very few people reside, maybe out in the woods somewhere. So with these rural areas, VRI is also a great option. It's a nice way for us to be able to respond to individuals' needs who live in those remote areas and provide services. And that's another one of the side benefits that we've realized through using VRI and providing services in that way. I'm just glancing back to my notes here to make sure I've covered everything I'd hoped to. Let me see here. I also want to mention that it's improved really the deaf consumers' accessibility, meaning that they're able to access high-quality certified interpreting services throughout the state. And it guarantees the deaf consumer to have communication access at any time, at every point of entry, whether it be they're going to a hospital, whether it be they are brought into custody for fingerprinting, for the booking process, whatever it might be. VRI seems to satisfy those unpredicted, unplanned, last-minute kinds of needs that come up. It provides very quick and effective interpreting response time. So these are the advantages that I see through using VRI. I think it's a nice opportunity to be able to work personally for me from my home. And not only that, but it improves my efficiency in terms of how I use my time. And I say that because what normally happens is that I will arrange for some in-home office time for myself during the week, making sure I catch up on my email or take care of all the billing that needs to be done. So I'm able to do that kind of work from home. And now, in addition, while I'm working from home, I can also be available on call to provide interpreting services. And it's just a few feet away from my desk that I'm able to provide these interpreting services. So that's another great advantage. It also saves on travel costs, and as we know, gas is so expensive these days. Once again, just another advantage. I can see VRI becoming even more responsive for people and being more of an option for people who want to utilize interpreting services. As our roads become more highly trafficked and congestion is as such it is in cities, making that commute for interpreters to actually get to where they need to be can be very cumbersome. So VRI is another option to be considered. Also, I can see as well there are some differences between face-to-face work, working on site as an interpreter, versus working as a VRI. I mean, it could be the exact same setting, and in fact, here in Minnesota, we use VRI for emergency or urgent need kind of interpreting provision, be it in the jail or hospital or whatever it might be. But we've also started to use VRI just for regular kinds of settings like employers' meetings, when the employers are meeting with their employees, educational settings. So we've also found it effective in those arenas. Anytime a lawyer was trying to screen an individual or ask some questions, we may want to see about using VRI. Sometimes the judge will ask that the VRI be used. But again, we need to make sure that the individual involved is accepting of that idea, and I would just be cautious about, putting VRI in a legal setting as making it the model. And we've seen it modeled in medical settings, but it's just not as easy to pick up that same kind of system and apply it to the legal setting. I think a little more work needs to be done there before we can say that it's going to be an effective option. Back to the medical setting, we will often use VRI for things such as triage, as I've mentioned, those initial questions that the patient is asked just to get a sense of why they've come to the emergency room, what brings them there, what their symptoms are, how they're feeling. Those are the kinds of questions that we can work through via VRI. And then we also connect to jails. And typically that's to provide services while an inmate is being booked or during a medical questionnaire. Anytime somebody is put in jail, they're asked a variety of different questions about their medical history. And in doing so, they'll meet with a nurse to get those questions answered. The nurse will ask questions about what kind of medications they're currently on, if they have any medical conditions. And, of course, these are things that need to be considered while a person is imprisoned. So we provide VRI services for that as well. There are also non-emergency, non-urgent VRI services that we provide, sometimes through early childhood education classes and family education classes, ECFE classes. VRI services are utilized. Those meetings may be just 1 hour, or it might be that in an employment setting, an employee is meeting with their supervisor about a particular project or a work performance issue. That's another way VRI can be used. VRI can also be used, again, back to the medical setting again, just for a regular well checkup, just for a physical to make sure everything's, doing fine. So VRI is also another way to provide services. My personal experiences have been that my work with VRI throughout the years has been for pretty nominal kinds of things that last maybe a half an hour, maybe as long as an hour, but typically not anything over an hour. So generally the settings are such that the exchanges are very quick, things that are unplanned for. That's predominantly been how I've been working in VRI. Now, certainly there are challenges to doing this kind of work. In fact, one of the things about VRI is how you're able to actually view what's happening. And just to explain what I mean by that is if you can imagine a patient in a medical setting, they're lying on a gurney and they're being asked questions by a doctor, and the patient can see me on a screen, of course nice and clearly, but it's my ability to see what the patient is saying that can sometimes be compromised, because very often the camera is positioned in such a way that I'm not seeing them face on, but rather I'm looking up their nostrils, which is not a nice picture. It's not a clear picture for me as an interpreter, and it can create kind of awkward setting. Oftentimes I'll be asking, hospital personnel or the deaf person to move the camera, reposition it so that I can see what the deaf patient is signing and see it clearly. So that is one of the disadvantages of VRI in an emergency room situation. In a triage area, typically the patient is seated upright and answering questions, so it's almost just as if you're connected to them through a VP, and that's not as difficult. But when they're in an examining room on that gurney, that's where we come into some problems and have to sometimes make adjustments accordingly. Let's see, some of the other challenges are, again, back to my ability to see the deaf person. As an interpreter, we only see the deaf person on our screen. We cannot see who else is in the room with them. We hear people speaking, and we may be able to assume there are some people because we hear different voices, but we have no sense of the number of people in the room, where they're positioned in the room, and who they are. So, again, that creates a little bit of a difficult situation at times. It's helpful if people identify who they are and who's speaking. And very often, as a VRI interpreter, I'll ask individuals if I hear a voice that they introduce themselves, that they indicate who they are. And of course, that is a bit more time-consuming, and people don't typically do that sort of thing, so it's a little unnatural for them to have to say their name each time they want to make a comment. but they get used to it and get used to the way it functions. And oftentimes, they'll say something like, over there is this and such, or we want you to do something like that. Again, as an interpreter, these indiscriminate kinds of references are very difficult to understand. We have to ask to get more clarification. So I might say as a VRI interpreter, when you just said like that, could you clarify further what that is? Just to get information from them so that I can provide an accurate interpretation. And very often I'll ask the hearing person to become more explicit in terms of the way they're speaking, just to eliminate some of the ambiguity. Now, one area that has been a pretty big challenge for us here in the state of Minnesota is that we have this process called a report. So in a medical situation, there's a report process, and very often what that means is that whenever a nurse is changing shifts, the incoming nurse or the outgoing nurse will report to the nurse who's taking over the shift what's transpired during their shift. And they'll update them on every situation and what's happened, what procedures have been done during that shift, or what is foreseen to be done in the upcoming shift. So this information is shared between the two nurses. And it's not just to share gossip information just for the purpose of talking, but rather to provide a very well coordinated care to the patient. And here in Minnesota, many interpreters have followed those same kinds of processes. So what that would mean is that if I'm an interpreter and I'm working a 6-hour shift with a particular patient, maybe I've worked with them through the operating room while they've gone from there to post-op and recovery, and now we're back to the patient's room. When the other interpreter comes on to relieve me, very often we would spend a couple of minutes and do the same kind of reporting out. I would share with the oncoming interpreter the information that's pertinent for them to know so that they can provide the best interpreting services during their shift. That way they have a good, clear history of what's happened, what complications may have occurred, what procedures have been done, and what procedures are to expected to happen throughout the next couple of hours. So just general sharing of information is helpful. Now, back to VRI, one of the problems that we've noticed that's a bit of a challenge is that the VRI interpreter, and sometimes the VRI interpreter doesn't always come from our particular area. Sometimes the VRI interpreter may be from someplace else in another part of Minnesota. And so those interpreters are not aware of what's happened in terms of our best practices that we follow here in our area. And I know I personally have experienced coming into a situation as an on-site interpreter, and I see that the patient has been working with a VRI interpreter until I have arrived. And once I come to take over the interpreting work, I'm expecting some kind of report about what's happened or what's transpired, and that way I can anticipate what is to come, and I can, just as we would, work as a team with the interpreter who is now going off screen. So the VRI interpreter, once they see me, very often will immediately disconnect, assuming that their job is done and they're ready to leave, the services are no longer needed, because the live interpreter has come on site and will now take over the interpreting work, which of course leaves me very much unaware of what's happened and not able to get the information that I need so I know what's happened and what is to happen. So this being the case, I'll often have to approach a nurse or someone else to get filled in. And the information I get from them, it's not always the kind of information that I'm looking for. It's not always, as you might say, as helpful for me as an interpreter. And sometimes nurses will look at me and question as to why I'm asking this information. They don't really understand where the question's coming from and my need to know the information. So either it seems I either get too much information or not enough information when it's from a healthcare professional. So I'm trying to figure out a way that we can improve the teaming between the VRI interpreter and the on-site interpreter. How it is that we can better work together as a team when half of the interpreting has been provided virtually and the other half now is being provided in a live kind of setting. So this has been a big challenge that I noticed, and this is something that our field is going to have to come together and talk about and really come to terms with. Here in Minnesota, we have begun to develop some best practices for VRI work. And some of those best practices include things such as it might be that the VRI interpreter and the community service agency are being provided through the same agency. So the VRI interpreter is coming from the same agency as the community interpreter comes from. So if that is the case, they're following the same kinds of processes, same kinds of guidelines and principles because they're coming from the same agency. So that's something that's to be considered when VRI is being provided. Another thing is that VRI interpreters often need background information. We can't just suddenly come up on a screen sort of cold and expect to do the best work. We need to have some kind of an outline or some kind of information, maybe meeting with the triage nurse or the doctor prior to working as an interpreter, providing our interpreting services. Because that way we can get background information, we get a sense about what the person is there looking for, and that information helps us become more effective as interpreters. Another guiding principle, and again, I know this is kind of intimidating for live interpreters, but VRI interpreters need to have somewhat of a technical background, even if it's just to do some quick troubleshooting. If the interpreter doesn't know which button to push or how to focus their camera, or if they're struggling because maybe it seems as if we're clear but we can't see the other person clearly. I mean, these kinds of little issues have to be remedied by the interpreter. And nobody's there to help us with that, so we have to figure out, as the interpreter, how to best troubleshoot through some of the technical issues that may arise. And I guess the last thing I want to say here is that this is still an emerging field. It's still developing as a concept, especially when we talk about teamwork and how it is we can work as a team. And what's it mean to have VRI and on-site interpreters teaming? And what if we're teaming with other VRI interpreters, or we're teaming instead with maybe the on-site interpreter, the live interpreter with the VRI? How is it that we can best go about providing teaming? Well, I hope with this I've been able to give you a little bit of information about my background and share with you my thoughts, my beliefs, and my experiences as they pertain to VRI, and also some ideas of where we hope or want to further develop our work through VRI. And thanks for watching, and I hope that you've enjoyed this symposium. So long.